Hi, Mark Powler, co-founder and CEO of Insurgent Technologies Incorporated. In this video, we're going to take a look at really what needs to be done to actually provide people who need health services what it is they actually do require. Now, in today's world, everything is siloed. You need help, it's siloed, okay? So for example, if you need a doctor of some sort, you have to find that doctor, make an appointment, and go through all that rigmarole we talked about in an earlier video, right? Now, of course, what happens if it happens to be a Saturday or something else? Well, now you can't necessarily get in touch with your practitioner. So now you're forced, like it or not, to walk into probably one of the places you never want to go, and that is where? The emergency room. Why? Because you really don't know what's going on with you. There's no one really there to help you. You can't get in touch with your doctor. So now you're going to spend probably the entire day sitting around a lot of very sick individuals trying to get the help that you need. So does any of this make sense? The answer, of course, is no, it doesn't. All right? A hospital today it's a general hospital, can do all sorts of things, cannot do all of those things well, no matter who they are. Certain things they do well, other things they don't, right? So here you are, you're looking for assistance, all right? So now you're forced to go into a healthcare system in some way, shape, or form. This is definitely not working for reasons I talked about before. Millennials don't want to get anywhere near hospitals, don't want to get anywhere near doctors' offices, okay? Plenty of other people don't either, right? And there's a very simple reason why. You walk into a hospital, what's in there? You've got all these super bugs inside there, okay? And of course, they don't even talk about the candida, okay, superbug, which of course sporulates, which means you could be walking out of the hospital with it into your own home. They're not really talking about that. They're not telling you how many hospitals have that type of problem. So in you go, right? Does any of that make any sense at all? The answer is it doesn't. So why isn't health services more ubiquitous? This is how we see the future, okay? You need to have certain tests done, great, or something, fine. You wake up one morning, something doesn't feel right, okay? So what do? Well, you can pick up the phone, try to make an appointment to see the doctor or your practitioner. Most likely the office isn't open yet, you gotta get to work, okay? You might try to leave a message, and of course, maybe sometime later on, you'll get a message back, okay? That is not convenient. That is not something that you want to prepay somebody for, having to wait around for a response. So what's the answer? Well, the fact is the answer already exists to some extent. It's called telemedicine. It's where you could actually send a secure message over to your practitioner, whoever it is, and at least notify the practitioner that here's what's going on with you. And if that practitioner then can easily, take a look at your health records and then decide what needs to be done. Fantastic. So let's go through that scenario for a second. Here you are, you woke up, you don't feel well, and now you want to send a message over to your health practitioner. Terrific. You grab your EasyMed app, part of your smartphone, you type out a secure message, it's sent over to the practitioner. Great. You get dressed, off to work you go. As you're heading, closer and closer to your office, all of a sudden you receive a short message from the practitioner that says, "Hey, look, I need you to do this test." Okay? And you got three choices. Choice number one, the practitioner can send it to your home and you can do the test yourself. Or, okay, you can come to the practitioner's office and he'll perform a test for you. But of course, that's in the opposite direction. Last choice, of course, is you can go to a testing center. Well, that's kind of novel. What's a testing center? Well, imagine, for example, you could walk into a Best Buy. You could walk into a Walmart. You could walk into a Walgreens. You could walk into a CVS. You could walk into almost any retailer, and standing there, okay, is an EasyMed test center. You walk in, okay, the app that you have basically goes ahead and can talk to the app that the person who's manning the test center. You can exchange information, know what tests you need. The entire process takes 3 minutes you take a drop of blood, you leave 3 minutes, count them, 3, okay? And then you leave and go off to your office. Fantastic, okay? By the time you get to your office, all of a sudden you receive a message telling you that the test has been completed and it's been shared with your doctor, okay? So where's all of that wasted time, all the inconvenience? It's gone. It's unnecessary, all right? And then what happens? Maybe now it's about 1 o'clock in the afternoon, you receive a text message from the practitioner, you receive a secure message from the practitioner that says, oh my God, it looks like you need a lower dosage of one of the medications you're taking. And again, you could come by the office and pick it up. Okay, I can have it shipped to your home, or you can go to a local pharmacy and I'll make sure that the order goes in. Terrific. End of the day, you go back to, to maybe a local Rite Aid or some other pharmacy, but you told the doctor that's where to send it, picked up the medication, the new dosage, you go home. Did you have to go in the doctor's office? No. Did you have to waste time creating an appointment? No. Did you have to wait for days to get test results? No. Isn't this really what people expect from healthcare? Is it's really that ubiquitous, that easy, okay? And things can be dealt with rapidly instead of waiting weeks or months on end for something to happen. This is how we see the future. This is how EasyMed is going to deliver the future, okay? It winds up helping practitioners to be far more efficient in use of their time and energy in helping a particular patient. It helps the patient because now they don't have to go through all of the trauma and all the drama of trying to get this appointment set up, doing all these things. Instead, they get the convenience and efficiency that they long for. And by doing things like that, all of a sudden, maybe millennials will start looking at medicine and doctors in a completely different light, because this is what needs to change. And this is what EasyMed is trying to bring about. This is just one of many things, how we see the future as being very different, and how we're doing our best to bring that about. Again, I invite you to visit our website at www.insurgenttech.com, 1T in Insurgent Tech. I'm Mark Paller. Thank you for listening.